I always liked kiwi, but I never really ate them very much. But I started doing the research on them, and kiwi is pretty amazing. First of all, it's a great source of vitamin C and fiber. And the vitamin C actually has tremendous antioxidant effect, and it can protect your DNA. And studies have been shown that actually if you eat one kiwi a day, it'll protect your DNA against damage by about 60%. If we ate 3 kiwis, it would actually help your body build any damaged DNA back by about 60%. And so here's something simple that you can peel, cut up, chop it into a yogurt, or just eat plain. It's delicious. You can put it into a smoothie that actually has this amazing ability to actually protect your genetic material. Like, that's so fundamental, and it tastes great and not too sweet, and it's got a little citrusy flavor. Then the other thing that's great about kiwi is that it's packed with fiber. Now, fiber is basically, a kiwi is essentially a prebiotic food. Its fiber feeds our gut microbiome. And studies have shown, there's a study done in Singapore that showed that just eating a kiwi, even one kiwi, overnight will start to change your gut microbiome, favoring more healthy species of bacteria. And so, like I always tell people, like, if I tell you something like that and you try a kiwi, you can't unlearn what I just told you. Every time you see the kiwi, you're going to say, you know what, I know there's something good about it. And then if you remember what that is, that's really what I try to do with my course, is really try to teach people how to make it second nature to make great choices and to be enthusiastic about it. Like, I think most people are kind of intimidated by, this is, kind of like the whole philosophy behind my course. People are intimidated by diets, right? To begin with, they're a little, maybe I didn't do so good in my life. I should do better. It's always, people go into a diet in order to try to get better. And what I try to shift that paradigm is, look, if you're serious about getting healthy, and this is the time you want to actually do it, it's not that difficult. You just kind of dive in, engage. You do want to be awake. You need to be alert. And you got to realize it's not about somebody feeding you a superfood or a super supplement, and that's all you got to take every day. It's really about understanding more about you. It's self-knowledge about how your own body works, right? Like, at some point, we all figured out how our eyes work and how our lungs work and how our prostate works and our uterus. Figure this out. This is like the cutting edge science. You want evidence, you want food as medicine, and you want to know that it's not about memorizing food. It's about memorizing how your body actually works, and then recognizing our bodies actually work really well to complement certain foods. And so, what does a tomato do? A tomato contains lycopene. What does lycopene do? It actually protects our prostate. Man, that's a really good thing. Also protects our breasts. That's a really great thing. You don't need to remember all the chemicals. You just need to remember that that's the way to do it. And then I try to get people to be passionate about cooking, because, one of the antidotes to unhealthy eating is really trying to get back into the kitchen and preparing your own meals. You don't have to be a fancy chef. You don't even have to have a fancy palate. If you can fry an egg, you can actually cook healthy food. And that's what I try to do, is to try to make people feel like, lower your guard. It's not a problem. You can actually learn how to do this. And, there's nothing more satisfying to me than to actually go out and, find some great looking, healthy, fresh foods, figure out how to cook them and taste it myself. Like, it's like, like back in wood shop when you were in junior high school and you created your own toolbox. Like, man, that's really cool. I made that. And that's how I want to get people to feel excited about food as medicine. This is not hard. It is not a burden. It's not an onus. This is something that you can do. You can make for yourself.
Let's talk about polyphenols a little bit more, and give us some of the highlights of some of the research that you came across in that area.
Right. Well, so, let's take the word down, polyphenol, and break it down into what it actually means. A phenol is something a chemist would understand. You could give a chemist a piece of chalk and a chalkboard, and they would draw what that chemical structure looks like. And a poly of the phenol just means there's a lot of those little chemical structures floating around. And that's all you really need to know about the chemistry of what a polyphenol is that it's kind of a building block, and there's lots of different ways to construct polyphenol. So polyphenol is not a single molecule or a single chemical. It's actually a family. And so, I sort of think about it in the best possible way. It's sort of like ammunition, like ammo. And so there's different types of ammo that you can actually give your body and give your microbiome as well. and the polyphenols belong into different categories. So you've got tea polyphenols, you've got cacao polyphenols, you've got fruit polyphenols, and any one of these foods have more than one kind. And so it's part of the diversity and richness of any single food that we actually have. And what I love to think about is, for example, red grapes have polyphenols, and when you actually make wine, it's the polyphenols that actually have the same coloring that gives the red wine its characteristic color, and the stuff that settles at the bottom of the vat when you make wine. That's also really, really rich with polyphenols, which is why red wine is richer with polyphenols than white wine. But that's not the only thing that has polyphenols. Tea also has polyphenols, as we talked about EGCG. And we tend to kind of gravitate towards understanding one or two, but there are thousands of polyphenols in a cup of tea.
Many which we don't even have a name for yet.
We don't even have a name for half of them. Like the most undiscovered country is not outer space. It's actually inside our food. It's like the inner space of our fruits and vegetables, the produce section, and also some animal proteins as well. I think there's some really amazing things in seafood, shellfish, seaweed, things that are not classically, grown on a farm. And so that's what's exciting to me is discovering these things. There are polyphenols in almost every fruit and vegetables, where you're talking about a cherry or a cranberry, or whether you're talking about a plum. You've got polyphenols that are there, and there are all even polyphenols in tree nuts that can actually be very beneficial as well. So I think that the term polyphenol is known as an antioxidant, but for example, when we eat them, let's just use green tea as a great example of polyphenols. You sip a cup of tea. Our body absorbs some of it. Some of the polyphenols, like EGCG, the epigallocatechin gallate, actually feeds our gut microbiome. The bacteria also get to share in whatever it is that we consumed, whether it's tea or fruit. And so the bacteria are digesting these polyphenols. As they're digesting these polyphenols, the bacteria are creating their own metabolites, right? So anytime we put in something in, gets crunched, and then there's metabolites that come out. Same thing as a bacteria. And what the bacteria produce, you mentioned the sort of the orchestra producing music. The bacteria produce these other metabolites called short chain fatty acids, sometimes called SCAFAs. There's three main ones that are made. The number doesn't matter, but really, I mean, unless you're like really hardcore about it, but these short chain fatty acids, actually, they help lower cholesterol in our bloodstream. Another one actually lowers inflammation, which is a really good thing. Another one actually helps our blood sugar, our body use blood sugar better. And some of them are anti-angiogenic. They starve cancers by cutting off the blood supply. They groom our circulation as well. And so here's sort of this daisy chain of effect, where Mother Nature's put something into the food is consumed by us, we absorb some of the good stuff, and it activates our body's cells. But some of it also goes to our bacteria, and our bacteria also get to get the upside of whatever we ate that's good stuff, and they digest it and produce their own metabolites. So we produce metabolites from polyphenols, our bacteria produces polyphenols, and that's all part of this incredible health defense systems. The more good stuff that we eat with polyphenols, the more we actually benefit from it, and we start to flood our own system with the good stuff, which leaves less room for the bad stuff. Dr. Zitvogel was doing this research. I helped to convene a conference called Rethinking Cancer. Like, how do we rethink our whole approach to cancer? Kind of a fresh start. And she found that in 200 consecutive patients with different types of cancers, all getting immune therapy, if you split them up into groups that responded and did really, really well with their immunotherapy, had their immune system, attack and wipe out the cancer, versus the people who didn't do well, where their body didn't respond the right way, the only difference between the responders and the non-responders was one bacteria in their gut, and that one bacteria was Akkermansia, and it's Akkermansia muciniphila. That muciniphila actually says it all. This bacteria, which is considered now to be a guardian of our microbiome, it's one of the guardians of our health, loves to grow in the mucous membrane, in the mucus inside our gut. So our gut, actually, most people don't know this, but actually our gut has mucus. You know this if you have diarrhea, it's very mucousy, but there's some mucus in there all the time. And that mucus is sort of like topsoil for Akkermansia. It loves to grow in there. That's the garden of the Akkermansia, where this guardian bacteria loves to grow. So if you take antibiotics, you can wipe out your Akkermansia like that. Okay, and then you got to grow it back. And so what she was finding is that people who were not responding to the immune therapies, you need a good immune system, that they were missing their Akkermansia. We have got these guardians in our microbiome that we have to take care of. And the reason that I got involved in this food as medicine is that you cannot eat an Akkermansia probiotic. So you can eat a lot of other bacteria and probiotics, but you cannot eat Akkermansia. The only thing you can do with Akkermansia right now is to grow it yourself. This is a DIY kind of bacteria. And the way you grow it is actually by creating more healthy mucus, that topsoil that it likes to grow in. So how do you do that? You do that with food as medicine. So pomegranate, cranberry, Concord grape, the juices. You only need 8 ounces of a glass of cranberry juice, pomegranate juice, and you'll be able to actually grow back this Akkermansia. I had a cancer patient, by the way. This was a couple of years ago, who had multiple myeloma, was going to get an immunotherapy, and her doctor was really gung-ho to get her immunotherapy, her oncologist, and her kids had a cold, so she had got a bronchitis and got a Z-Pak. Okay. And so before we started this immunotherapy, I basically said, let's check your stool. Sent out her stool for Akkermansia, 0, which
Wow.
you would expect from the Z-Pak, okay, and the antibiotic. And so I said, no, let's put the brakes on here. So we skidded to a halt before actually giving her the immunotherapy. I'm like, we do not want to waste this shot on goal. Like, this is her shot. And so I gave her cranberry juice and pomegranate juice. And we had her drink for 3 weeks straight every single day. And then we tested at the end of 3 weeks. So we delayed her treatment for 3 weeks. When we tested her stool again, she had 6 times above the average population of Akkermansia. So she really killed it and got a ton of Akkermansia. She got on her immunotherapy, and within 3 treatments, she responded to the upper 1% of responders. So she was like super responder, and just completely recovered from her cancer, like completely wiped it out. And again, this is sort of me learning from research that had been done and published in research and evidence, thinking about how food fits into it, and actually using our body's own defenses to really help itself. This was not food versus medicine. This was food and medicine. And I think that's something I want your viewers to really take away from. Like, we're really not talking about food versus medicine. Like, we're way beyond that. Honestly, you can still have that battle, but it really is about this totality. We want to be able to figure out how to use all the tools in our disposal to be able to win this battle, which is called our life as we journey through it. And if we can enjoy ourselves with food along the way, then that's really having our cake and eat it too.